Hello, this is Hope Rosky with Business, Arts, and Events, and today I have with me an amazingly wonderful guest. Her name is Karen Tesi, and she is with Kiss Me Med Spa. She's one of the partners there. Welcome to the show.
That's right. Thank you for having me today.
I am so glad you're here because you have some of the latest and greatest when it comes to working with the face and rejuvenation and collagen, and we're going to address all those issues on the show, and I'm so excited to talk to you about it. So tell me a little bit about your background, Karen.
Okay, well, I have been a nurse for over 40 years. I started in cardiac, and then one day I was looking at myself in the rearview mirror putting on my lipstick, and I thought, I think my face is falling down. And I remember I called my mother from the car and I told her that, and she just laughed at me and she said, "Oh, Karen, it's just the beginning." And I thought, oh, no, I have to do something about this. So at that time I grabbed the phone book, because this was in those days, and I found a dermatologist who just started doing Botox in Fresno.
Oh, okay.
It was brand new. They had just gotten their FDA approval. It was brand new in this year that I was looking for this. I went and had it done. 2 weeks later, after it kicked in, I fell in love with the results. Immediately quit my job, went and got training to learn how to do it, and I have been in aesthetics for the last 21 years.
Fabulous.
Yes,
I think that's great, because sometimes in life we just have certain things happen and we just get taken in different directions.
Yeah.
And so you're in your happy place, which is great.
Oh, totally.
One of the things that I think people kind of may get confused about is the difference between Botox and fillers.
They do.
And they do. And maybe you can tell the viewers a little bit about the differences with that.
Yes, and I love to answer that question because I do it every day. So, of course, I know the difference, and I assume if I know something, everyone else knows it too.
Right.
But the difference between something like Botox, and there are competitors now. We have Dysport, we have Jeuveau, we have Xeomin, we have Daxxify, and there's more and more coming out as the years go by. What those things do is they stop movement of muscles. And by stopping the movement of the muscles, particularly in here, I would squeeze for you, but I can't because I have Jeuveau on board right now. You stop the muscle from moving, that stops the wrinkling from happening. So that's what Botox does. It's typically injected, now mind you, we're injecting it everywhere now, but typically in between the brows, forehead, around the eyes. We can do it in the lower face. And you want to stop all that dynamic movement because that's what's destroying your collagen and making the wrinkles deep. Okay?
Right.
So what fillers are, they're made out of different materials. The majority of the fillers are made out of hyaluronic acid. Hyaluronic acid, if you look at it, if you squeeze it out of a syringe, it looks like hair gel. And we all know what that looks like, just a clear, thick gel. And those products do exactly what the name infers. They fill up something that has lost volume. So, as we age, the corners of our lips kind of tuck in like that. We look like a little pruny thing around the mouth. So we can actually put a little bit of filler in the lips, and it just brings them back out to where they used to be. We can do cheeks in the mid-face to lift the cheek. We can do it in the chin to give projection along the jawline to help give a little bit of an angle there. We can put it in the hands to make the hands look younger. Under the eyes, we can put these things a lot of different places. So in a nutshell, the difference is if you want to stop the movement of a particular muscle group, you would use something like Botox, Dysport, those products.
Right.
If you want to add a little volume to something that's sagging down and has lost its perkiness, that's where we reach for filler.
Okay, great. Well, and I think you did a great job in clarifying that part of it. So let's talk a little bit now about the laser, because that's something new that's being introduced, and you brought in some wonderful video, and I'd like to take a look at the first part, and if you could just tell the viewers a little bit about what they're going to see here in this particular one.
Okay, so I'd like to first explain to them what lasers are and what lasers do. There are many different types of lasers. There are lasers that will melt fat. lasers that will tighten skin, lasers that will reduce hair, lasers that will remove some tattoo. There are lasers that help with snoring, lasers that help build collagen. There are dental lasers. I mean, there are lasers that do all kinds of things. Treat melasma, which is a brown, sun damage, sunspots through here, lasers that treat little tiny veins and redness. I mean, you name it. Lasers do all kinds of
they're magical. They're magical.
They really are. They really,
Yes.
really are. And there's new technology coming out all the time. We ourselves, I think we have 8 or 10 lasers now that do all of those things that I was talking about. And I have some of my favorite treatments. I really like lasers that stimulate collagen, because as we age, we lose collagen, and that happens faster and faster the older we get. And believe it or not, you start to lose collagen in your late 20s and early 30s. It happens really early. So, like anything else, the sooner you start treating something, the better it's going to be in the long run.
And that's why it's so good to be proactive instead of coming in reactive many times. So just having that knowledge ahead of time and saying, okay, in my 20s, I'm starting the process of losing collagen. Now I may start thinking about how do I just keep that momentum going and be ahead of it,
Right.
than starting from behind.
Yes, and like I said, it's much easier if we start younger. It takes less treatments. You never look your age if you start younger. A lot of times, unfortunately, we see people coming in, my daughter's getting married, in 6 months. My son's getting married. I'm going to my 50th class reunion. What can I do? And it's like, okay, well, going to take a little bit of time. We're going to have to do some combination therapy here. And it would have been much easier had they have started younger.
Sure. So with that being said, and with tightening, there are different places with women as they age. Not only do we see it in the face, but also even in the chest, neck area. So I know that you have one of your videos here that talks, or it will address that.
Yes, and the neck and the chest, believe it or not, can age 10 years faster than your face. And a lot of times people are just focusing on their face, where, this really needs to be addressed as well.
So tell us a little bit about what's going on here.
Okay, so this is IPL, Intense Pulse Light Therapy, for a chest for a woman in her 50s. And she was a lover of the sun, out at the pool, going to the tanning bed, going on hikes and walks, and not thinking at all to put sunscreen on her chest. We always think about it for our face.
Right.
But our chest is always exposed. Even if you're just driving in the car and you say, I never go in the sun. Well, you're driving in the car and the sun's coming in the windshield.
Right.
It's coming through the side window. So we get a lot of sun damage. And of course, as you approach 50, you are going to, start to see it.
Yes.
And the sun damage looks like brown spots, red spots, wrinkles. Definitely you'll see a textural change on the chest.
Okay, so we're going to move up from there to the face, and let's talk a little bit about photofacial. And this is one that people, I think, that they are going to be sensitive afterwards a little bit.
I think with most lasers, I can think of one in particular where you have no photosensitivity. You could put your makeup on and go out and do whatever you want afterwards. But with a photofacial, in fact, I just had one yesterday, and you can see I'm not all torn up. I don't look really red. I have a little makeup on, some sunscreen on. Photofacial really shines when it comes to treating redness. So if you have rosacea, if you have a lot of little broken capillaries, I had a few capillaries under my eyes that were broken, and I did the treatment yesterday, and I noticed today completely gone on one side, little residual left on the other. So I probably need one more treatment. But a photofacial is a wonderful thing for evening out your pigment. It is non-invasive. It's just a flash of light, and it's a wonderful treatment.
That sounds great.
Yeah.
And then what else do you have? There's another one that I know you have, and the goggles I think are very important, or the eye coverings too, because of the sensitivity as well.
Well, you can actually go blind from certain lasers if you don't keep your eyes covered. So not only the patient, like in this instance here, has to have their eye covers on, but also the technician needs to wear protective eyewear.
And what are you doing in this particular video?
So in this particular video, this patient is in her 70s. She's having what we call laser resurfacing. So that particular laser, what it does is every time it makes a flash there, it's basically vaporizing the top layers of the tissue. And that hose is a little vacuum that's vacuuming up those little fumes and those pieces of tissue that is getting taken off by the laser.
I see.
And with laser resurfacing, we can actually program how much downtime you want to have. So, busy people don't want a lot of downtime. If you're retired or you don't work, you don't care about downtime, we can go fairly deep. But you can get beautiful results by staying superficial, maybe 2 or 3 days of downtime, and doing this a few times, I think is actually safer and much more comfortable than doing a really deep laser peel that takes your whole face off. You're covered in Vaseline and ointments like that for 2 weeks. A lot of downtime. I don't think people like that anymore.
Right.
I really don't.
And that's good, because if people will plan ahead of time, they're active people, that this gives them the opportunity not to have that downtime, and
Yes.
they just need to plan ahead a little bit more.
Yeah.
So how can people get in touch with you if they have any further questions about
Well,
this?
you can always call. We'd love to see you for a consultation because, you know, coming up with a treatment plan takes a little time and it's a
Sure.
little complicated. We have to find out what your goals are, what your budget is, you know, what exactly do you want to treat, because maybe, like if you were to come in, I would look at you and I might think, oh, I could see what I could do, and then when I ask you, so what concerns you? You point to something completely different that I never even really thought, really? So we do like to have a consultation. So they can call, they can text our number, they can send an email, and we would just really like to go over all the options, because maybe laser isn't for somebody and they want to approach it a different way.
And I think one of the things that you do, which I think is wonderful, is you also do an inventory to make sure, you know, what is somebody's health background. Are they on medication? And I think that's something that you do, which is so important. Can you tell the viewers why that is essential?
Well, certain medication make you photosensitive, meaning if you have a laser procedure, you have more of a tendency to maybe get a burn because you're on a certain medication. Not all medications do that, but certain ones will. And so we always like to get that health history to see, you know, if there is a medication that could cause a problem, if you are, shall we say, allergic to the sun, if you're photosensitive, if you hyperpigment really easily. All these things will help us decide how we want to go about solving the issue that's concerning someone.
Well, Karen Tesi, I thank you so much for coming in. And can you just share with the viewers where you're located and your website if they want to take a further look and come in and see you?
You can find us on Yelp, Instagram, Facebook. We're Kiss Me Med Spa. The website is kissmemedspa.com. Our phone number is on the screen. We have an email on the screen, and you know, we would love to see you. We'd love you to come in. And you and I were talking a little bit about brides.
Brides, I was just going to say there's something special coming up. Tell the viewers about that.
Yes, actually tomorrow, which is Sunday the 5th, right, of January, we are going to be at the Platinum Wedding Expo, which is being held from 11 a.m. to 3 p.m. at Table Mountain Casino. So we will be talking to people about, you know, what they can do to prepare, you know, for the big day, whether it's the mother of the bride, the groom, grandma, grandpa, the bride, all the bridesmaids. Everybody wants to look great walking down that aisle, and we have a lot of options.
And let's not forget the groomsmen and the groom, because
Oh, yeah, they
sometimes
wanna look good, too.
Yeah, they would look good too.
Definitely.
Well, Karen Tesi, thank you for coming
you.
in,
It's my
and
pleasure.
it's just a pleasure to have
Thank
you.
you.
And again, that's Kiss Me Med Spa. This is Hope Rosky with Business, Arts, and Events.